Assalamualaikum warahmatullahi wabarakatuh. Hello ladies and gentlemen, thank you for your attention. Okay, I will introduce myself. My name is Linda Nasriatin. I am a postgraduate student from Halu University. I will present my journal entitled Epidemiology of Heart Failure in Konawe Regency, Indonesia for the period 2018 and 2020. Under the guidance of Mr. Ramadan Toseko. Introduction. Heart failure is one of the causes of morbidity and mortality and a high prevalence of cardiovascular disease. Several risk factors of heart failure include hypertension, diabetes mellitus, smoking, and obesity. These risk factors have substantially different contributions, considering that the presentation of the diagnosis and the patient's age between men and women are very different. Heart failure can be experienced at any age in men and women. In addition, risk factors also depend on age and gender. The risk of individuals aged 55 years older is about 1 in 5 people, and survival range from 20 and 50% after initial diagnosis within 5 years. Methodology. This study used data from the Indonesian government. Data on heart failure case was obtained from the annual data of the Konawe Regency Heart Office from 2018 and 2020. Findings are present in image format. The results show that the number of cases of heart failure has increased every year in the last 3 years, 2018 and 2020. Most cases of heart failure occur in August to October. This means that efforts to control non-communicable disease, heart failure, in Konawe Regency have not given maximum results. The distribution of heart failure by age in Konawe Regency is known that in 2018 the most cases were at the age of 55 and 99 years, and in 2019 and 2020 the most cases occurred at the age of 60 and 69 years, while the least cases occurred at the age of less than 14 and 19 years. Then the second smallest case occurred at the age of more than 70 years. Cases of heart failure by gender in Konawe Regency from 2018 to 2020. The distribution of patients with heart disease was more in women. In the case of heart failure in Konawe Regency, the most cases were aged 55 and 69 years, and the least cases occurred at the age of less than 14 and 19 years. The prevalence of chronic heart failure in patients aged 35 and 74 years. The prevalence is higher in urban area. During aging, damage to the structure and function of the heart is the cause of the risk of heart failure. The need for interventions to combat the age-related decline in cardiac performance is becoming increasingly urgent. The understanding of cardiac aging and aging in general is very limited. However, the decline in cardiac performance with increasing age can be prevented through interventions such as exercise that can be used as therapy of heart failure. Conclusion. The incidence of heart failure obtained from the Konawe Regency Health Office from 2018 to 2020 found that there are more women with heart failure than men, with the distribution of cases increasing every year. The incidence of heart failure is dominated by the age range of 44 and 69 years. Ladies and gentlemen, that was the result of the presentation of my journal. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.